Today we are going to see the important topic in Unit 3, that is visually evoked potential. As all we know already that what is mean by evoked potential, and we have three different types of evoked potential. In that first we will be going to discuss what is all about visual evoked potential. So the learning objective of today class is that in this class you are going to get deep knowledge on what is mean by visually evoked potential and its principle, and what are the different recording techniques, that is electrode placement for recording visually evoked potential, that also we will be discussing. And also we will be discussing what is the applications and limitation of this particular visually evoked potential. Let's move on to the topic. Why this particular topic is very important, what is the problem and why it is needed. If you see any sort of problems the people who are facing, it all type of problem is usually is a subjective, like it is according to their perception and their feelings, right? So the traditional methods what we have already is especially is giving a perspective like subjective analyzing. That is a need of you need that you have to quantify the problem in order to have a better treatment. So that is a need of having objective assessment. That's why we have brought here the visual evoked potential. It is very good method which will deal with the subjective assessment of visual function, and also it give a very good quantitative measurement of visual pathway and its integrity. So that is the main motto of this particular topic that I have brought here to deal the problem of which is being faced in the case of traditional methods. So let's move on to the main core of what is mean by evoked potential. Just I will give a few glimpse of evoked potential introduction, then I will move on to the what is mean by visually evoked potential. So as all we know that the evoked potential is some sort of electric potential which is being generated in the brain in response to the any sort of external stimulus which is particularly applied to the sensory area. Because in our brain we have sensory areas. When if we applied any stimulus over there, in response to that, if that is a production of stimulus, I mean potential, then it is called electric potential. That potential is nothing but evoked potential. So these potential is very much important to read or to analyze or to diagnose any sort of problem related to the sensories area. So now we'll move on to the visually evoked potential. So visually evoked potential is again its kind of evoked potential which is generated at visual occipital cortex. That is a sensory part of the brain which is highly responsible for visual. If you see the generation of these electrical signals over the visual occipital cortex in response to the visual stimulus, then but that particular stimulation is called recording is called visually evoked potential. Here we are recording the electric potential in response to the visual stimulus to the particular sensory area, that is a visual cortex, that is the visually evoked potential. So see, that is the visual pathway that I have given in the diagram on the right hand side. Beyond the retina, if you are doing any sort of assessment from the retina to the brain, then we have to go with visually evoked potential. So this visually evoked potential will give clear objective techniques to assess the visual system beyond the retina, and also it give very good detailed information about the pathway from the retina to the brain, how the brain is working, whether the brain is receiving the signals from the visual pathway, is there is any obstruction or disturbance, like that we can easily analyze. So that is the main beautiful of this visually evoked potential. Let's move on to electrode placement of visually evoked potential. Here also we are following an international system of 1020 electrode system. The thing is that here in the 1020 electrode system, here we are going to concentrate only on the area which is really responsible for the sensory part of eye, that is the occipital cortex. So that is that particular area is going to be here act as the active area. So the electrode which is going to place over the area which consider as a active electrode. So here we are representing that active electrode in the letter called OZ. Because the O represent occipital, the Z we are representing, we are placing out on midline. So that is the occipital region. So if already we know, if any sort of active electrode, it will not give any single electrode will not give any electrode potential, right? We need a pair of electrodes, because these sort of electrodes will record potential difference between the two electrodes. So if you have active electrodes, we need a reference electrode, that we will place it on frontal region. So it is represented by the letter FZ. And then we have a ground electrode. This ground electrode will helps to neutralize any interference or noise. It will act as like balancing the interference. So that is the reason we are placing the active electrode, ground electrode, that we will be placing in any place like forehead, mastoid bone, or earlobe. So these are the three different electrodes we will be focusing in place of electrode placement for VEP recording. So one is active electrode, second one is reference electrode, and third is the ground electrode. So what is the output we get after placing this electrode, in the sense in the form of waveform, as like in EEG, we here also we get a waveform. So but the each and every components in the waveform is very important. So here they have a plotted this waveform as a components. You can see N75, the first component, second is P100, and third is the N135. So this NPN, these are nothing but it represents the peak peak sign. That is, N is the negative peak and P is the positive peak, and again N is the negative peak. So this particular graph we are plotting against time, okay, right? So voltage against time. So the N75th is nothing but is the first waveform, at the first negative waveform, which is being produced at 75th second. Okay, that is the meaning. Here we are representing N75. Similarly for P100, this is the first positive waveform. It's being produced at 100th second, and similarly N195 is nothing but the second negative peak, which is produced at 135th second. So these are the things or the components which is highly represents the track in the visual pathway. If you are having waveforms approximately at the ends 75 at negative waveform at the end 75th seconds, it represents the you have a reflection movement, that is a action potential propagations from dorsal lateral genucleate nucleate to steroid cortex. That is the pathway it clearly represents. So if there is any delay in this particular seconds at end first negative, we can clearly identify the problem where it has been located. That is a area between dorsal and LGN, that is a lateral genucleate nucleate to steroid cortex. In particular area you can have some problem like that, we can easily identify. Similarly the P100 will also clearly represents the area, that is the dorsal extrasteroid cortex, that is exactly it represents the occipital cortex, that is a middle occipital gyrus area. So the P100, it is a predominant waveform compared to N75 and N195. It clearly represents how does the occipital region is being active. If there is any problem in that, you can see clearly in the deflection of these seconds, latency seconds, like instead of P100, if you are getting P105 or P110, it clearly represents you may have problems, you may have some problem in that particular area. That is the reason we have three different components we will be recording, VEP components, VEP recording techniques. One is N75, P100 and N195. Among this, the P100 will give the clear picture of how does that occipital sensory area of the brain, especially for occipital region, is working on. So we have different simulation methods because already we know that visually evoked potential is a recording of electric potential in response to the visual stimulation, right? Any sort of visual stimulation. Here we are giving the stimulation in the form of three different ways. One is pattern reversal, second one is flash stimulation, and third one is pattern appears, that is on and off set. So in case of pattern reversal, we will be representing the checkboard pattern. One is black white, another one is white black. In that form we can be used checkboard pattern. This is most commonly method, as if the number of times the grating is changing, we will be keep on recording. Here you can see the very strongest P100 response compared to other two. The flash stimulation is like something is different compared to the pattern reversal and pattern on and off. The reason is that when the people subjective response is very questionable, if it is not reliable, then we'll move on to the flash stimulation, because here we are not depends upon the patient's response. Immediately we can record the a particular response over the brain. That is the reason we can going with the flash stimulation. So it is mainly usable for recommended for infants, some kind of people, infants or elder or very old people. So some sort of people we can go with flash stimulation. So we will be giving brief light flashes, and we will be recording the response for that brief light flashes. Okay. But the thing is that it is very less reliable than pattern. Then we will move on to the third type, that is pattern on and off. Here first we will be giving on, that is a checkboard pattern, and we will go with the off, that is a black very dark blank background, and then again we will go with the on and off. So similarly we will go with the pattern appears and disappears. So in the on segments the pattern we will project it, or the off segments the pattern will get disappears. You will just have a empty background. This is highly recommended for doing some sort of research, who is working on this visually evoked potential. In that case, this particular technique is very highly used, or commonly used. So out of these three stimulation, the choice of stimulation is again depends upon the types of people, cooperations, and then visual acuity of those people, and then they may have a different physical, clinical problems. So according to that, we can choose any out of these three. Then we'll move on to the applications. I have told already, the clinical application of visually evoked potential is huge. You can have your surgical monitoring, multiple. You can easily early diagnose the multiple sclerosis, and then you can have a clear-cut diagnosing of demyelinating disorders, axonal loss disorders, even migraine headaches, and it give a very good objective functional assessment of your visual pathway. So the clinical application of VEP is a huge. We can use multiple cases to have a better objective functional assessment. So at the same time, on the other hand, we have the limitation of VEP also. We have so many technical problems, because some people may have large bulky Googles to in order to have stimulations. That in that case, the patient cooperation will mismatch. So in that case, you will not have a quality outputs, and the clear vision also there will be the problem, because this particular technique will not give a clear picture of what is your visual acuity, that is the clarity of your vision. It will just assess the objective, it will give assess the pathway, visual pathway beyond the retina to the brain. So that is the reason it has some drawbacks. You may face the technical problems, and it will not give the clear picture of your clinical vision. And then that is a cases you have to give the anesthetic to record the potential. So these are the few limitation. Yes, thank you.